Inside. Oh gosh, I can't choose both. Both.
Okay.
Oh my gosh. Beach. How brave I've become. It has to be reading my journal in the morning and then going straight to exercise thereafter. I am Dr. Sihle Sibiya. I am 47 years old. I come from Durban, Umlazi actually, KZN. I am a specialist pediatrician. I treat children under the age of 12. I think ever since I can remember, I wanted to be a medical doctor. My grandmother would tell me from the time I was 4 years old, I would say that I want to help people. So I've always had this inherent desire to treat people and to help people in need. I think I decided to become a pediatrician during my internship and comm service. I did my training in Tembisa Hospital, where I just fell in love with pediatrics there, and the way the children recover, the way they respond to me. It's just a very fulfilling environment, and that's when I realized that I want to focus on children especially. No, I grew up in an area called Umlazi. In fact, that's what they used to call it, which is, I think there was a thief that used to live up the road. So there were no real doctors that I looked up to. I think it was probably from TV, I guess, reading, that I developed the desire to want to become a doctor. So I didn't have a specific role model coming from the area that I grew up in. So I had an interesting childhood. Although I grew up in Umlazi, I had the most strictest grandmother. So I had the kind of upbringing where I had to stay indoors. I was a total introvert. I was very nerdy. Fun for me was reading books. So I would hear Ngoma, Goloba, and those kind of games that you're referring to. But honestly, most of the time I was indoors, and I was actually not even allowed to go and play outside. I used to long for it, but ekaya, it was a no-no. So my social media was basically created to empower my patients. It came up with all the kind of questions that in my consulting room would come up. So I decided that there are so many experts, right, on social media, and there's not enough professionals who are giving the correct information. So as I was chatting to parents in the consultation room, I realized that there's a gap and there's an opportunity to educate beyond my consultation room. I want to reach mommies who don't necessarily come to my office. And that's what I use it for. I try to make it fun. I try to break down common medical questions that I get asked and common medical conditions that I see, and make it short and easy to digest, and also it helps. A lot of my patients also say that I showed your video to Ugogo, for example. So it helps beyond just the patients or the mummies that are watching the video. They're able to share that information with their extended family. My other passion is fitness. I enjoy hiking. I am an aspiring runner. In fact, I recently summited Mount Kilimanjaro last year in 2024. So hiking, being in the outdoors, running, gym. I do a lot of exercises as well. I love reading as well. I don't read enough. I wish I had more time to read. I love baking sometimes. I grew up in a bakery, so I still do that sometimes. So I have two mentors. The first one is Dr. Njamegwane, who I met at King Edward Hospital. So my medical training was initially in KZN Durban, and then my pediatric training was this side in Wits University in Johannesburg. So Dr. Njamegwane was the first black female pediatrician I met in my early years of training, who inspired me to also love pediatrics. I think Dr. Pepeta at the time, who was also a cardiologist, also inspired me, taught me a lot during my junior years of training. And then subsequently as a paediatrician, when I was doing my rotations at Baragwanath Hospital, I met a Dr. Chira, who's currently the clinical head of Nelson Mandela Children's Hospital and my current mentor as well. I think she's the one who's also inspired me in my pediatric journey. Because I'm a pediatrician, I'm a generalist. I'm a general pediatrician, so it ranges wildly from developmental disorders. I see developmental disorders like autism, ADHD. I see chest infections. I see colds and flus that are complicated that maybe the general practitioners have not managed to deal with. I see tummy conditions, so anything related to the babies, especially because I see a wide range of ages, from the ages of newborns all the way up to about 12 and a half. So it's anything children related I see because I'm a general pediatrician. I think dealing with the parents as well as the patient is quite challenging because you can imagine the stress and the anxiety of mothers when they have a sick child. So it's like I have multiple patients. It's the child themselves who are the patient, and then the parents as well, the mom and the dad or whichever caregivers. So for me, emotionally, it's when things are not going well. As much as I treat sick children and I'm trained to treat sick children, it does get challenging when they are very ill and they are not improving. It especially gets challenging if I lose a patient. That's emotionally draining. I know people think that as doctors we are used to it, but losing a patient is actually very devastating, especially because we fight very hard for those babies and those children, but obviously sometimes things don't work out very well. I think that I've found over the years with experience is to listen, to be empathetic. I think it helps that I'm a mother as well, so a lot of the experiences that the parents that I see are going through, I can identify with them. So I've kind of tell my parents that this is our child. So we become a team, it becomes a family, and we navigate the journey together. So it ends up being not only about the medical care of the child, but it ends up being supporting the mothers, supporting the fathers as well, because there's a lot of present fathers as well, and any caregivers that come with the mother. With the child, sorry. Yes. I attend deliveries of babies, which is one of the most rewarding moments of my job, receiving new life into the world. I absolutely love that. I think it's a very sacred moment. I think this particular delivery was special because the family had been struggling to have a child, and they had a long journey to get to the point where this baby was born, and we were all aware of that. And that moment where the first cry happened, just looking, I think it was the dad's face that I saw at that moment and the tear dropping from his eye. I won't forget that. A lot of people think that it's easy. They don't understand the challenges that we go through in terms of children. I think the biggest misconception we're dealing with at the moment now is vaccine hesitancy, where they think that we're pushing vaccines and that vaccines do harm, where in fact the vaccines we use in childhood have been around for centuries and they've been proven to work to protect children from common illnesses. That there are kids out there who just can't access specialist pediatrician care that they need. I think that we know all the problems about the public health system in terms of resources. And I think I worked in the public health sector for a long time, moving into private and seeing how much we can offer children and seeing how little babies can do well with the right interventions and the right resources can really change a lot of their lives if they had the access and all the resources that we have in private. I would advise them to focus on their physics and their mathematics. I would say to them that to not forget to look after themselves as well. The profession can be brutal. The demands are very, very high. The training is on another level. and they mustn't lose hope in terms of trying to get into the system, because it's still very, very, very competitive. I would say to them to do more than just achieving high marks. Show that you care, volunteer, don't forget yourself in the whole race to become a doctor. And a good doctor is someone who's well balanced, who looks after themselves as well, and who's passionate about it. Don't do it because your parents want you to be a doctor. Do it because you want to be a doctor. Then it will be easier for you to navigate the challenges that will obviously come up.